Hi, and welcome to the Healthy Built Environment for Health Professionals training series. We are very excited today to be introducing Shane Wadden from Northern Health, who will present his presentation titled Healthy Communities in Practice. All right, I'll pass the mic off to you, Shane.
Thanks, Kelsey. For those who don't know a little bit about Smithers or haven't had the joy of visiting, it's a tourist town by nature. Smithers can be easily called one of the most beautiful towns in the north. The tourism in Smithers includes skiing, mountain biking, fishing, hiking, and much more. Smithers and the Bulkley Valley have often been described by non-residents as being distinct from the rest of northern British Columbia. Many factors contribute to the composition of the society in Smithers, including the large amounts of the arts, environmental protection, local industries. That includes things such as forestry and mining. And within the community, there's a strong sense of pride, culture, and a high level of community engagement. Healthy Communities initiatives have been thriving for a long time prior to the establishment of the current Health Community Partnership. And because Smithers is a community I've most closely been involved with, I'll focus largely on the evolution of the Healthy Communities group within the town and the role that I've played as an environmental health officer and one of the Northern Health representatives. So what should be considered when deciding the level of partnership? As Jolene discussed previously, there has to be a want to work together, and there has to be a readiness to partner for any group to thrive and prosper. Also, it's important is a clear picture of what the group is trying to accomplish. This works better when it's prescribed at the beginning in an agreement letter, a form of memorandum of understanding, and then supported further by terms of reference that can then be used as a reference point to guide you for future practice. I don't think that I need to emphasize this to the audience, but it should be mentioned that depending on the initiative, there could be a large commitment or it could be a smaller one. There's also varying levels of commitment based on the structure that's decided. So let's look a little further at the progression of the Healthy Communities Initiative using Smithers as an example. So this is our history. In 2013 and 2014, Bike Smithers was developed. A task force was assigned that had clear objectives and start and end dates to develop strategies and initiatives to enhance the bikeability within the town of Smithers. So this included items such as signage, bike racks, safety training, and much more. There was an initial partnership agreement between the town of Smithers and Northern Health. This was the start of it all. In 2014 and 2015, there was a seed grant distribution, so $15,000 was awarded by Northern Health and distributed to local community groups within and around Smithers. The partnership was expanded at this time to include a local non-for-profit society referred to as the Bulkley Valley Social Planning Society. 12 groups from the community were awarded funding for up to $3,000 each, with the majority of groups getting what was applied for. Initiatives include upgrading of community spaces, Dudes Club enhancement, a variety of wellness and healthy living projects. In 2015-2016, with much focus going into community vitality in other communities, it was decided that the group would begin to look closer at community indicators and attempt to create a better vision of how the community measures health. There are many other sources of information, but the goal was to work with the community and specific stakeholders to gather statistical information that may not be reflected in other areas to create a community vitality report card. Work was done to, number one, identify key players from a variety of sectors to ensure input was available from many distinct areas. Number two, to bring these key players together at a local forum to think harder about the indicators that matter and where this data may be available. And three, to involve the other members of the community by providing information in the form of a public event and a presentation by Dr. Trevor Hancock. In 2016-2017, we're currently working to amend our terms of reference and our agreement to ensure that those intended outcomes, commitments from partners, and time and resources required are all clear for those involved. So what is the level of involvement? Well, we often wonder what the level of involvement will be required and where we should start and stop. I suggest that environmental health officers and other health authority representatives act as the coordinator to keep the group on task when you begin to run astray and the person that removes barriers from practice by coming up with solutions to identify problems. Of course, this will always be a group effort, but someone spearheading movement makes it easy for others to be and stay involved. I wish I could paint a picture that said you will need this many hours of involvement, but I think that we all know that wouldn't be practical and will vary based on your assigned agreement and the terms of reference. In 2013-2014, because it was a task force of local community members committed to biking, and they were involved during the initiative, the role was minimized. So the role of the EHO at that time was limited to support, review, and acting as the liaison between the town of Smithers, the assigned task force, and the Northern Health Healthies Community Group. In 2014-2015, the task force was disbanded as our primary goals had been achieved, and further discussions about continued partnership were on the table. The town at the time had limited capabilities for another committee and could not provide a full commitment, but emphasized the wish to continue to keep the Healthy Communities Partnership alive. It was at that time that we decided to modify the structure of the partnership and assign another group to handle the bulk of the work, with a review of the progress coming every several months from the assigned steering group. The group assigned was the Bulkley Valley Social Planning Society, and it was their job to create criteria for local seed funding application, analyze the incoming applications, and distribute the money to the community. The group of 3 representatives, so Northern Health, Town of Smithers, and the Bulkley Valley Social Planning Society, would meet every few months to ensure decisions and process aligned with Northern Health and the Town of Smithers. So 2 primary goals were identified in 2014-2015, and they were, number 1, support the Bulkley Valley Social Planning Society in being the lead recipient of the Stream 1 grant and managing applications, evaluations, and reporting and dispersal of the small seed grant funds to the local initiatives. And this was the $15,000 that was previously discussed. And number 2, to explore the development of a more inclusive multi-stakeholder partnering for Healthy Communities Committee, with the consideration for other key stakeholders both in Smithers and potentially the broader Bulkley Valley. In 2015-2016, it was decided that our focus would shift towards the Community Vitality Initiative. The town would take on a larger role in the project, as a report card would be a product of the towns. This involved a larger role from the town planner, with the environmental health officer supporting the completion and review of documents, assisting with coordination, and continuing to act as a liaison between the group and the Northern Health Healthy Communities Group. The partnership between the Town of Smithers, Northern Health, and the Bulkley Valley Social Planning Society remained, with several members acting as representatives from each group. The 2016-2017 level of commitment is assumed to be moderate, as the bulk of the load has already been carried. So it may depend on you and your community. In closing, there's often a varying level of commitment that may not only come with your job as an EHO, but also with your personal preference. Since my arrival in Smithers in 2010, I've been a member of the Bulkley Valley Social Planning Society and support them not only as a Northern Health representative, but also as a member of the community. Currently, the Bulkley Valley Social Planning Society has created updated help cards that are distributed throughout the community to assist those in need, support the operation and functioning of the Smithers Community Directory, which provides direction to health services available within the community, support other community groups under the Society's umbrella, allowing them to apply for grants that may not have been otherwise available under their structure. Also, the dynamics in your community may impact how your wheels of progress will turn. Smithers is lucky to have an active and involved mayor in Taylor Backrack and health service administrator in Cormac Hickish. These key players are integral to the sustainability of ongoing partnerships. Thank you for your time.